Hi, Nurse Sherry here, and today we're going to be going over fluid and food intake. All right, so here's an example of a meal. So we'll call this the breakfast. We had toast, we had one container of eggs, and then we had another container of oatmeal, and then we also had bacon and oranges on the plate. So when we look at these, as you can see in the picture, we're going to do 25, 50, 75, or 100%, or zero if they've refused or didn't have any. I would document a few bites, and I would just write down a few bites if somebody only had a few bites. So when looking at this one, I would put down 75% of the meal that they ate. And then when we look at the cups, for the fluid intake, these are each going to be 4-ounce glasses. So when we look at this, we're looking at 30 mils for every ounce. So this first one here, if it was 4 ounces, it looks like about 50% is gone. So that is going to be 2 ounces that's left in the cup. And then 2 times 30 is going to be 60 milliliters. So that is how much the patient has had intake for that cup. And then we're going to add this one. So that's going to be 4 times 30, which is going to be 120 mils. So we have 120 mils plus 60 mils. So 180 mils so far intake for breakfast. And then we have a coffee cup. And I don't know if you can see as well as I can, but it looks like about 1 ounce is left in there. So we'll just do 3 ounces is what the patient had in, and 3 times 30 is going to be 90. So we have 180 over here plus 90, and that's going to give us a total of